Hi, this is Sarah Gribbin. I wanted to talk about adaptive leadership and how I've seen it in practice and how I could use it potentially in future practice. When reading about adaptive leadership, it's very follower centered. So maybe working with your employees and your patients and hearing what they have to say and what they're seeing a lot, and how you can take what they're saying, digest it, and then apply it in practice. And so one way I've seen that as a nurse for my unit is I work for a float pool staff in San Antonio, Texas. And so when the government was shutting down the cities for COVID and we were canceling elective surgeries, we didn't need the float pool staff as much as we had before. And so it was the first time our unit was very neglected from the rest of the hospital. And so our leaders were starting to notice, but they didn't know exactly what to do. We kind of stayed with the status quo for a little while, but our staff was being canceled so often. People were getting very frustrated, both techs and nurses. We had to do a lot of communication with our bosses to let them know, we were very unhappy with the situation. We needed to work. We didn't want to use all of our paid time off. And so it took a lot of time to kind of see what we were going to do about that situation. So what we ended up doing was reaching out to the Bexar County jail and seeing if their units there needed help. And they did. So what we did was we started cross-training, and I was one of the nurses who did end up cross-training to work at the jail and get some experience there with COVID to learn how to take care of them while the city wasn't getting hit as hard with COVID. That really helped limit the amount of people who left our department because people were getting to work more. Because then a few months later, we got hit very hard with COVID and needed the staffing back. And had the leaders not adapted to that change, we could have lost a lot of staffing to other places, taking contract jobs or just leaving for another hospital. And we ended up really utilizing all the staffing we had and more. So it was very important that we made those changes in our unit and then used them and for when we were getting hit really hard with COVID. So that was one way I feel like I saw adaptive leadership used, because our leaders really heard what we had to say, heard our frustration, and definitely adapted to it and found something that worked for us. So that was really good situation. But one way I think that I could use it as a future APRN would be, I liked the conversation when we talk about challenges. I like talking about adaptive challenges. So how can we address or become knowledgeable of, address, and adapt to challenges we face in the workplace? We can do that by having bi-weekly or monthly meetings with all of the staffing, trying to have maybe a few optional dates a month, like 2 optional dates a month, to have staffing available, because everyone has busy schedules. And then we would be able to hear what our staff is seeing and what they have to say, or what they think our patients are seeing from us and what we could improve on, and we could make that better. And then also another way to talk about technical and adaptive challenges would be having those in-services and meetings as well, because then we'd be having in-service to keep all of our employees up to date with the current practice, the best practice, and we'd also be able to have those meetings to really learn about what they're seeing and also what we're lacking, whether that's in equipment, in employee numbers, or anything. I feel like that would keep employee satisfaction high, which would keep patient satisfaction high, which would also be cost effective. And so those are some things I think. And then also just talking about how we could do that for our patients, maybe online. We could post videos or do Zoom calls now with technology becoming so big, to further educate our patients on their disease processes. And so that when they're home and they're not in the office, they can keep up to date with their health through educational videos that we have available, whether it's made by us or we get it from reliable sources to share with our patients so they can keep up to date at home about whatever health conditions and concerns that they have. And then they can always call us for them. So that was one way I think we could use adaptive leadership in our current changing times when it's becoming so big into technology.